Menstruation, or a period, is a natural biological process that most women experience throughout their reproductive years. It typically begins in puberty, usually between the ages of 10 and 15, and continues until menopause, around the age of 50. Menstruation is a sign of a healthy reproductive system, indicating that a woman's body is preparing for the possibility of pregnancy. The menstrual cycle is a complex series of hormonal changes that occur in a woman's body each month. It is a carefully orchestrated dance of hormones that regulates the release of an egg from the ovaries and prepares the uterus for potential implantation of a fertilized egg. The purpose of menstruation is to shed the lining of the uterus if pregnancy does not occur. The menstrual cycle is divided into several phases, each marked by specific hormonal fluctuations and physiological changes in the body. Understanding these phases can help women track their cycles, identify potential irregularities, and make informed decisions about their reproductive health. The brain plays a crucial role in regulating the menstrual cycle through a complex interplay of hormones. The hypothalamus and pituitary gland, located in the brain, release hormones that control the ovaries. These hormones, namely follicle-stimulating hormone, FSH, and luteinizing hormone, LH, act as messengers, signaling the ovaries to produce other hormones, such as estrogen and progesterone, which are responsible for the physical changes that occur during the menstrual cycle. The follicular phase is the first phase of the menstrual cycle, typically lasting from the first day of menstruation to ovulation. During this phase, FSH stimulates the growth and development of follicles in the ovaries. Each follicle contains an immature egg, and as the follicles grow, they produce increasing amounts of estrogen. Estrogen is responsible for thickening the lining of the uterus, preparing it for the potential implantation of a fertilized egg. As the follicular phase progresses, the rising estrogen levels create a positive feedback loop, further stimulating the pituitary gland to release more FSH and LH. This surge in LH triggers ovulation, marking the end of the follicular phase. Ovulation is the process of releasing a mature egg from one of the ovaries, typically occurring around day 14 of a 28-day menstrual cycle. During ovulation, the mature egg is released from the follicle and swept into the fallopian tube, where it begins its journey towards the uterus. The fallopian tubes are lined with tiny hair-like structures called cilia, which help propel the egg along its path. If sperm are present in the fallopian tube during ovulation, fertilization can occur. Fertilization is the process of a sperm cell fusing with an egg cell, creating a zygote. The zygote then travels down the fallopian tube and implants itself into the lining of the uterus, where it begins to develop into a fetus. Section 4. The luteal phase and the absence of fertilization. The luteal phase is the second half of the menstrual cycle following ovulation. After the egg is released, the ruptured follicle transforms into a structure called the corpus luteum. The corpus luteum produces progesterone, a hormone essential for maintaining pregnancy. Progesterone thickens the uterine lining further, making it receptive to a fertilized egg. If fertilization does not occur, the corpus luteum begins to break down, leading to a decline in progesterone levels. This decline signals the uterus to shed its lining, resulting in menstruation. The menstrual flow consists of blood, tissue, and an unfertilized egg, and it typically lasts for 3 to 7 days. The first day of menstruation marks the beginning of a new menstrual cycle. The hypothalamus and pituitary gland in the brain initiate the release of FSH and LH, starting the follicular phase all over again. Section 5. Beyond the bleeding symptoms of menstruation. The hallmark symptom of menstruation is vaginal bleeding, but it is often accompanied by a range of other physical and emotional changes. These symptoms can vary from woman to woman and from cycle to cycle. Common physical symptoms include lower abdominal cramps caused by uterine contractions, which are common during menstruation. Some women experience lower back pain, which may radiate down the legs. Hormonal fluctuations can trigger headaches or migraines. Breasts may become tender or swollen due to hormonal changes. Water retention can cause bloating and discomfort. Many women feel more tired than usual during their periods. Emotional symptoms can include mood swings, as hormonal changes can lead to irritability, anxiety, or sadness. Some women experience increased appetite or cravings for specific foods. Insomnia or restless sleep can occur. It's important to note that every woman's experience with menstruation is unique. Some women have very mild symptoms, while others experience more severe symptoms that can interfere with their daily lives. If you have concerns about your menstrual cycle or symptoms, it's essential to consult with a healthcare professional.